During sleep, the muscles and tissues of the throat help to keep your airway open, allowing airflow into the lungs. However, this normal breathing can be disrupted by a condition called obstructive sleep apnea, or OSA. OSA occurs when the tongue and other soft tissues relax during sleep and obstruct the airway. This obstruction can happen at the soft palate, tongue base, or in many cases, both locations. Without fresh air, the oxygen level in the blood decreases. The brain senses a problem and arouses the body from sleep just long enough to open the airway. Regular breathing is restored, but only for a few breaths, and then collapse occurs again, restarting the apnea cycle. The cycle of obstruction and waking can repeat dozens of times per hour throughout the night, disrupting sleep.